So now, after evaluating the patient and performing the radiological tests as well as the lab investigations, now it's time to treat the patient. It's important to remember that treatment depends on the disease stage, and we have discussed the different disease stages before. So according to the stage, our treatment plan will be determined.
So guys, primary, secondary, and early latent syphilis is treated with a single dose of benzathine penicillin G given intramuscularly, and the dosage is 2.4 million units. Now, alternatively, we do have different therapies. So if any case patient is not able to take penicillin, you can give him doxycycline, ceftriaxone, as well as tetracycline. The doses of these medicines have been written down for your convenience, but I can understand that it's not suitable for medical students to remember them by heart right now. But still, if you're interested, they're there on the screen. Now, late latent syphilis is also treated with intramuscular benzathine penicillin G, 2.4 million units, but the dosage is a bit different. You have to give this once weekly for 3 weeks. Now again, there are alternative therapies which include doxycycline as well as tetracycline, and the doses have been written down for your convenience. Now, talking about tertiary syphilis is treated with intramuscular penicillin G, benzathine, and it's also given in the dose of 2.4 million units once weekly for 3 weeks. So there is some similarity between the treatment of each stage, but there is minor differences for you to remember. So it's important to remember those small differences. Now, the most important stage of syphilis to treat is neurosyphilis. And the treatment schedule of neurosyphilis is that it's given intravenously, and penicillin G is given in a dose of 18 to 24 million units daily for 10 to 14 days. Now, another high yield point for you to remember is that patients need to be followed post-treatment at 3, 6, 9, 12, and 24 months with serial non-treponemal tests. Again, a high yield point to remember is that a 4-fold decline in these tests indicates successful treatment. Now guys, I also want to talk about another reaction which is called Jerisch-Herxheimer reaction. It's a hard word to pronounce, so you can pronounce it any way you like. It is important to mention this here with syphilis because patients who are treated with syphilis with penicillin do exhibit this reaction. Now, following treatment with penicillin, the dying organisms often release inflammatory cytokines that lead to the Jerisch-Herxheimer reaction, which in essence is an immune-mediated self-limited reaction. The patient will suffer from headache, muscle pain, fever, tachycardia, and malaise. The reaction usually appears within 24 hours of starting treatment. The treatment of Jerisch-Herxheimer reaction is supportive. Now, an important point to remember is that pregnant women who develop this reaction need to be observed closely, as it can lead to obstetric complications.
So that's it, folks. It has been a very interesting discussion, and for those of you who have not slept during it, thank you so much. I've tried my best to cover all the topics in detail as much as I can and to make it as easy for you as possible. We've talked about the introduction, we've talked about its etiology, we've talked about the pathogenesis, its pathophysiology, and the clinical features, which are high yield to remember. And at the end, we have also talked about how to evaluate a patient with syphilis and how to treat it, which is also high yield. So if you're a medical student, do remember to go through this topic in detail because you will be tested about it. And if you're a new doctor, do remember that you will see patients with syphilis in your clinics and in the wards. So you need to be vigilant whenever you see any signs and symptoms like remotely close to what syphilis presents with. So keep an eye out, be vigilant, and happy studying. Thank you for sticking with us, and that's it for now. Goodbye.